Five things are ethanol in methanol poisoning, co-ingestion of cocaine and alcohol, maximum safe dose for paracetamol every 24 hours, refractory seizures, and doxylamine overdose. So the symptoms of first one is ethanol in methanol poisoning. So the symptoms of methanol poisoning are decreased level of consciousness, decreased vision starts at early as 12 hours after the exposure, and the long-term consequences or outcomes of methanol poisoning are blindness and kidney failure. So lethal dose of methanol is approximately 30 to 240 ml. So it is methanol is non-drinking type of alcohol used for industrial and automotive purposes. So the normal metabolism of methanol is methanol to formaldehyde, formaldehyde to formic acid. So the first stage is methanol to formaldehyde, which requires the enzyme alcohol dehydrogenase. So ethanol is given in the case of methanol poisoning if fomepizole, which is antidote for methanol poisoning, is not available. So how ethanol acts in methanol poisoning is by the enzyme in first stage, which requires for conversion of methanol to formaldehyde, that is alcohol dehydrogenase, which has higher specificity or activity towards ethanol. So instead of converting methanol to formaldehyde, it converts ethanol to acetaldehyde, which is less toxic, so resulting in methanol which is unmetabolized, excreted by the kidney as such. Okay, second one is effect of co-ingestion of cocaine and alcohol. So if we take cocaine along with alcohol, it causes greater neurological toxicity than cocaine alone. Third one is maximum safe dose for paracetamol every 24 hours. So in adults up to 5 grams for 24 hours. Every 24 hours one can take 5 grams of paracetamol. Fourth one is what is refractory seizures and how or what chemical causes it. So refractory seizures are frequent and severe enough that it means the medicine is not bringing it under control. So these are very difficult to control. Other names for refractory seizures are uncontrolled, intractable, or drug resistant epilepsy. As we know, seizures are also called as epilepsy. So these seizures are caused by theophylline toxicity. Fifth one is doxylamine overdose. So if we take doxylamine above normal dose, it causes non-traumatic rhabdomyolysis. So doxylamine is first generation antihistamine which is used as short-term sedative or hypnotic. So LD50 in humans for doxylamine is 50 to 500 mg per kg. So it causes non-traumatic rhabdomyolysis, which means extreme muscle pain, but it can be more dangerous if there is more muscle mass to break down.